We begin tonight with a look at testing in South Florida and why broadening the criteria is essential to getting a grasp of the situation.
NBC 6 anchor Carlos Suarez spoke to an infectious disease expert and joins us live now with more. Carlos.
Juwan and Jackie, healthcare experts have been clear about this issue from the very beginning. If you want to get a true sense of just how much of a strong firm this virus has on South Florida, you need to test as many people as possible, no matter the age and their health. Now, we have been leading the state in the total number of tests, but the data so far suggests that getting one of these tests still remains too strict. The drive-through testing site at Hard Rock Stadium is an example of what healthcare experts want to see more broadly, a testing criteria that allows just about anyone to get tested. As of this week, people with an underlying medical condition, regardless of symptoms, or people who may have come in contact with someone who has the virus can get a test at the site. Early on, only people over 65 with symptoms could be tested. Dr. Eileen Marty with FIU Health believes an even broader criteria is needed to get a clear look at how deep the virus has spread.
We're not capturing every case that is symptomatic, let alone capturing those individuals that are close contacts and isolating them from everyone else.
State health officials have touted the expansion of people tested and a decrease in the percentage of results coming back positive as a sign the outbreak in Florida has peaked.
Our work is succeeding. We have flattened the curve.
Statewide, the number of results coming back positive is down from around 18% to 10%. In Miami-Dade, the number is higher at 16%, and in Broward, it's 12%. Monroe is at 7%, with only 73 confirmed cases. Miami-Dade's rate has remained steady, even as it's tested more people, meaning the infection could be strong or the testing criteria remains narrow.
When you increase the pool of people that you're testing, the percent of positivity is going to change. Clearly, you're going to have more positive, a higher percent positive when you're testing the most severe cases.
Health experts are weary to draw a conclusion from a single data point, pointing to questions on the reliability of tests and an undercount of people with no symptoms.
At our facility at FIU, we're getting about an 8% positive rate. And remember, we know still that there are false negatives. So we're still struggling to figure out the best way, the most efficient samples to take.
All right, so CB Smith Park in Pembroke Pines is now testing people 18 years of age and older without symptoms. Now, we could see some of these positivity rates in Miami-Dade and Broward drop come the beginning of May, because that's when we're expected to see some of these test results coming back from some of these facilities that have now expanded their testing guidelines. We're live in Southwest Miami-Dade tonight. I'm Carlos Suarez, NBC 6 News.